Let's stay in the Bono region because the first person to test positive for coronavirus in the Bono region is a Togolese national who entered the country illegally. The regional minister has revealed this forms part of the 372 new cases that brought the country to a tally of 3,091 as announced by the Ghana Health Service on Thursday. My colleague Anas Abed joins us on the line with more on this. Anas, I also have the immigration. We understand that the immigration is working on this, and but tell us how people are reacting to the first case recorded in the region.
Well, this case, this first case has come as a surprise to a lot of the people we have been interacting with since last night, and to them it is shocking because all this while the region has engaged the people on ways they could prevent themselves and then ensure that we do not record a single case in this part of the region. However, activities in the regional capital and other parts of the region from our sources are ongoing. I mean, things are normal. People are embarking on their normal activities. With the exception that I see a lot of people now using the nose mask compared to the previous day. So it's shocking that people are still embarking on their trading activities as usual since the outbreak of this particular case here.
And we understand that this new case was recorded in the German North District of the region. Tell us about the area, how the geography is like and the demographics in terms of the people that live there. Do you have a lot of foreigners trying to come in there from our neighboring countries?
Yeah, you know, the Bono region shares border with La Côte d'Ivoire and the German North District with Pampa as the district capital has a border post which is connecting Ghana and Côte d'Ivoire to Sokou, which is the next community in La Côte d'Ivoire. And of course, a lot of the people who are living in Ghana, precisely Pampa, have other businesses they do in the neighboring region, which is Ontugu in the Ivory Coast. So there's an influx of people every now and then. But since the outbreak of the coronavirus pandemic, the immigration officials within this route have intensified their patrols to ensure that people do not get into the country from Côte d'Ivoire. But like we know, in most border towns, there are a lot of unapproved routes, and this Togolese national also got into the German North District. We are told used one of these unapproved routes into the country. So German North has been an area where a lot of foreigners get in and out of the Bono region almost on a daily basis.
Elsewhere, we've been told by the Immigration Service that the local people are assisting these foreigners to get into the country illegally. What can you say about the German area where you have a border linking us to, a post actually linking us to Côte d'Ivoire?
I cannot say here. For what I know with German North, there are several unapproved routes, like I said, and the distance is quite close. And so people who are living in the other side of the border get into the district by themselves, as in whether they are being aided by the local people in the German North. That I cannot say much about. Better, like most border towns, this is quite common with the influx of people in and out of
We understand that this individual did not come in alone. He was in the company of other people. Do you know if they are in police custody, where they are being held, whether they are also being tested? Do you have any information on that?
Yes, from the briefing that was carried out by the regional health director this morning, we know the person who has been declared positive is a 27-year-old Togolese man who entered into the country through the German North District together with 9 others, and we are told they were apprehended along the route somewhere in April, in the last week of April, by the personnel of the Ghana Immigration Service. The test results was received on the May 6th, that was 2 days ago, confirming that one of them is positive. We are still waiting for for the results of the other illegal immigrants who got into the country with them. They are currently with the security services that since their arrest, they were quarantined, and we are waiting for their results to see if they are also going to be positive or negative.
And let's talk about the adherence to the protocols in terms of the wearing of the face masks, the social distancing, the markets and everywhere else. What have you observed?
In Sunyani, for instance, I'm quite impressed with the issue of the wearing of the nose mask. In fact, it is more or less being enforced. People hardly use these people walking through the streets or onto the streets without them on. City officials or authorities have been enforcing that. I see a lot of this hand washing kits also placed at vantage points and so on and so forth. But the problem, like I said earlier, has to do with the other districts or municipalities outside the regional capital. There are some areas, especially the farming communities like Yamanlo, for instance. Some of these protocols are being flouted every now and then from my sources on the ground. So largely, I would say I'm impressed, generally impressed with what is happening within the region. In fact, the people from the one are ensuring that we stay away from recording cases. So this, once again, is coming in as a surprise to most of the people here.
Weeks ago, when you spoke to the regional director, he did indicate that the region has always been in preparedness for any form of pandemic and that they've always dealt with cases like this, except that because this is a novel coronavirus, the handling might be quite different. At this briefing that happened this morning, did he give you a sense of, again, how prepared they are in terms of the structures, the centers for isolation to contain the further spread of the disease in the region?
In terms of their preparedness, even before we recorded this particular case here in the Bono region, the health officials, in partnership with the Regional Coordinating Council, have issued several steps that have been taken to ensure that in case there's a recorded case, they will be able to handle it professionally. So the issue of isolation centers or quarantine centers have all been put in place even before this case has been recorded. And the health directors have also intensified its campaigns or its education to communities to accept or to ensure that even if there is a case, the issue of stigma or anything close to that will be handled properly. So for preparedness, authorities here in the region are up to the task from my observation, even before this case has been recorded.
For those who are defying the orders, especially in the marketplace, do you know of any arrests that have been made and the police preparing some of these people for court? In
fact, in the early moments when the Ghana Health Service at the national level indicated that the use of nose masks is one of the surest ways we could stay away from this pandemic, the authorities in the Bono region, together with the security forces, the military, and then the police, got into town and then started, enforcing that. So people will be running away when they see the police or the military, and since then, it is being, absorbed by the people. They are now embracing it, and they are doing it willingly without being enforced or being forced to do so. So from that, I have not come across people being arrested. I have seen people who were being chased away because they were not on their nose mask. And since then, the attitude towards the wearing of the nose mask have changed completely here in the Bono region.
Anas, thank you very much for bringing us up to speed on that first case recorded in the Bono region. That Bono region has recorded its first case, and let's go onto the phone lines again and speak to the health director for the region, and he joins us. Thank you very much, sir, for joining us, Dr. Kofisa.
Hello.
Hello, Doc. Thank you very much for your time here on Newsdesk.
Yeah, thank you very much.
Can you tell us about this first case and circumstances surrounding the arrest and initial testing and then subsequent confirmation of the case?
Yeah, late April, I think the last week of April, the Ghana Immigration Service informed us they had arrested 10 people who had come into Ghana through unapproved routes through the German North District of the Bono Region. And definitely they were handed over to the police and they were to be prosecuted. So they sent them to the court, and the court remanded them, I think, for a number of days. But then the immigration came with a request that in remanding them, they wanted to actually let us have their COVID-19 status. So we took the 10 samples from them and then sent them to the Kumasi Center for Laboratory Research. The results came back to us on the 5th of May, and out of the 10, 1 sample tested positive for the disease.
So you're saying that apart from this one, the 9 others are free of COVID-19?
Yes, all the results came, the 9 others where their samples were negative.
Okay, so let's talk about contact tracing.
Yes.
For the people who might have come into contact with this person, the immigration officers, the police officers, have you started that already? And are some people in isolation already?
Yeah, you know, I think we received a result through email on the 5th in the morning. So we immediately went to the district. We sent the result to a district, and you know, each district is divided into sub-districts. So all the sub-district teams have contact tracing teams. They came together and started work on trying to actually identify the contacts. Now the district team went to support them, and the regional team also went to support them. So we have been there on the 5th and yesterday, and so far we've been able to trace 78. We have been able to identify 78 contacts. 61 of these are in the German North District in the Sampa area. 17 of them are in Brekum. For the fact that, you know, they had been brought to Brekum to court on 2 occasions. So that then makes it 78 contacts. The team is gone back again because we have to make sure that we are able to identify all the contacts, both those who interacted with the group for a very long time and casual, such that we don't leave anything to chance.
Are you considering enhanced testing or mass testing, for want of a better word, for the German area?
Each district is doing enhanced surveillance and testing.
Okay.
So that stands aside, apart from these 10 whose sample, 1 sample tested positive. But all the enhanced surveillance samples we sent so far, as well as when we received them, they were all negative.
I can imagine that this person is already at a treatment center. How many treatment centers do you have, and what is the capacity?
We have 3 treatment centers, one in Brekum, the second is in Wenchi, and the third is in Sunyani.
And they can take up to how many patients, if unfortunate? How many? What is the capacity of these centers?
On the average, they have about 12 beds. Well, one has 16 beds, one has 12 beds, and one has about 8 beds. So on the average, if you add, it goes about 12 or 10 or 12 beds each.
So now you have a first case. Will that change your strategy as far as education is concerned?
Yeah, definitely. Our strategy normally would change. First, before the first case, well, you know, people would then concentrate on signs and symptoms and everything of the disease. But now that we have had a case, we then have to actually build on the competencies of why people should wear face masks, why they should social distance, why they should wash their hands, and to be able to make sure that surveillance and then detection and reporting, and to be able to also make sure that people are forthright in providing us with information and targeting the high risk groups, those who, like if you take long distance truck drivers, the market women, the health workers, and of course the security personnel. This is something in which the messages have to be targeted more towards social behavior and behavioral change communication, rather than just concentrating hitherto on the signs and symptoms of the disease.
Where are you doing your testing? Is it at the KCCR or you are going up north?
KCCR.
Very well. From where you sit, what has been the compliance level so far in the region as far as the protocols are concerned?
As far as which protocols?
The social distancing protocols, the washing of the hands, wearing of the face mask, which has become mandatory now. Do you see compliance?
Yes. It's picking up. As you move towards the rural areas, we still have quite a bit of work to do to be able to make sure everybody complies. But as you find people moving into the more densely populated areas, you would see people with face masks and trying to do hand washing and then also socially distance. You would have one or two breaches here and there where people would normally correct them. The problem is with the face mask because people keep moving the face mask to the chin, to the forehead, touching them, and a whole lot of things. So the past few days have been to able to tell people the do's and don'ts of wearing face masks. So in the more urbanized areas, people are catching up on what do they call it? They're wearing the mask and then the hand washing and all that. We have gotten the regional response team to try to do a very fast evaluation and assessment to be able to give us quite definite data as to what the gaps are to be able to make sure that we improve on the behavior change communication.
Dr. Kofi Issa, thank you very much for your time here on Newsdesk. And that's the Bono Regional Health Director. He spoke to us as the region has recorded its first case.